I'm Alyssa, and I did career as a healthcare administrator. What is a healthcare administrator? According to Public Health Online, a healthcare administrator is the manager with the responsibility of running a specific healthcare organization. So this could be something as large as an entire hospital, or it can be as small as a single medical practice office, so something like a chiropractic office. Duties include personnel management and financial organization. And in order to do these duties, you need to have a certain skill set. And so some of those things can include leadership, communication, professionalism, and you must be well focused on business out of everything. So educational requirements. So the minimum requirement for this position is a bachelor's degree, but this may prevent you from moving up to a higher level of authority because you just don't have as much experience or education or knowledge as someone with a master's degree. But this can be beneficial if you want to stay at a lower level until you want to move up to a master's degree. So a master's degree, you must receive one of the following three. So the MHA, which is a Master of Healthcare Administration, an MBA, which is a Master of Business Administration, or an MPH, which is a Master of Public Health. Internships are important because when you apply for a job, they want to see that you have already had experience in the field, and that sets you apart from other people who are also applying for the same job. Work experience can also be collected through volunteering or working for free in medical settings. Again, this will set you apart from other people who have not yet achieved a master's degree or just haven't done volunteering or CEUs of that such. Licensing, registration, and certification. So once a bachelor's or master's degree is obtained, you can move on to licensing and certification. Typically, you only need a license to work as a nursing home administrator, so certification is very important. So it's important because it validates the employer that you have already met all of the requirements for the state of New Jersey and that you can follow through with a further certification if need be. So examples of being certified include going to events, going to conferences, going to meetings, and again doing CEUs, which are continuing education units. Working environments. So there's a variety of settings that you can work in. Some of the following, which are hospitals, clinics, nursing homes, private medical practices, and managed care organizations, all of which can be focused on their own thing. So, for example, you can go for telehealth, free clinics, international healthcare practices such as the Red Cross or Peace Corps, recovery services, or even hospice facilities. Employment opportunities. For the future, the job opportunity rate is expected to increase by 23% by 2020, and this is promising because that percentage is a lot larger than other professional rates. So one of the major spikes will be within the nursing home administration, and this is due to the growth of the aging population. Now, wide variety of options are available. For example, nursing home managing, cardiac service administrator, or medical director. And some of these options include CARD, which is an association with autism, and that's a nonprofit organization or other nonprofit organizations that need help with planning and regulating HIPAA and such. So those are also places where you can be employed. The salary. There's a growing number of healthcare needs and administrators due to the rising amount of expansion in facilities in the state of New Jersey. So when you're just beginning, there wasn't a very set amount, because every website was different, because there's so many different places that you could work at within this field. So typically, if you're just beginning, you get around $80,000 to $108,000 a year. If you're just an average healthcare administrator, you would get around $115,000, and if you're at the highest level, you typically get around $144,000 a year. Professional organizations. So here's 3 of them. There was about 6 of them that really stood out compared to other ones. So the first one being MGMA, which is Medical Group Management Association. They have 33,000 members. Group practice managers are the majority of the people who are in this association, and this has a lot more opportunities because there's so many members, therefore a lot more people can collaborate and things like that. The AAHAM, which is the American Association of Healthcare Management, since this is focused on finances and business, it also provides information on healthcare laws, since healthcare is always changing. And the AHCAP, so this is focused on healthcare administrators on the executive level, meaning the highest level, and this organization strives to help people with the same goals. So those who are looking to transition to a higher level will be helped by the people already on that higher level. Alright, thank you for listening to my presentation.